So one of the questions with Enfortumab vedotin is when is it safe to stop treatment, and how can you maximize outcomes? And so in collaboration with an outstanding fellow, Dr. Michal Sternschus at MSKCC, we looked at our retrospective data of patients who stopped Enfortumab and looked at their outcomes relative to the time on treatment and the type of response that they had. And we found that patients who are on Enfortumab with a response for more than 8.5 months, if they stop treatment, the median time off treatment without progression, so a treatment-free, progression-free interval, was 30 months, 2.5 years, which is really an outstanding number in a refractory patient population. This was EV monotherapy, not combination therapy. This is third or fourth line therapy for most patients. And for those subset of patients with more durable responses, those responses were able to be maintained. One of the impulses these days is for oncologists to pull patients off Enfortumab quickly to avoid toxicities. But if you do that, you may be depriving them of longer-term benefit that they may derive if they're responding to therapy. And so we need to start thinking about what is the optimal duration of treatment for these patients, especially as this permeates the practice in the first-line setting with Enfortumab and pembrolizumab. We don't know the data for those patients because we don't have the long-term experience with the regimen at this time, but we'll be certainly looking at that in the future in our MSKCC cohort.